top military officials have gathered on this premises for the commissioning ceremony of remodeled and renovated primary healthcare center and staff quarters in Olugbo, Odeda local government area of Ogun State. The army band blares in the air, giving a sense of something good ahead on this day. Friendly and familiar gestures were made amongst officers, most of them top-ranking, as others drawn from civil society and friends of the army, all under one umbrella, with natives of Olugbo. It is here that the crème de la crème, represented elder statesmen and sons of the community, gathered. Some chatted in groups, others waited patiently for the event to kickstart. Smiles and laughter depicts an air of satisfaction. They didn't wait for long though, as the representative of the Chief of Army Staff delivers the message on this occasion.
Affords the Nigerian Army the privilege of strengthening civil-military relations through promotion of healthcare initiatives, advancing community development and the quality of life of the people of Olugbo towards the Nigerian Army in discharging its constitutional responsibilities. The Chief of Army Staff Special Intervention Civil-Military Cooperation Project Scheme is one aspect of the Nigerian Army's non-kinetic approach geared towards addressing the multifaceted security challenges facing our beloved country. The execution of these projects reiterates the Nigerian Army's commitment to partnering with communities across the 6 geopolitical zones of the country, where our troops are deployed for the purpose of promoting growth and development. The projects are designed to contribute to infrastructural development, support communities in their areas of need, and further strengthen our relationship with people in the benefiting communities. I'm glad to state that this approach has endeared the people of Nigeria to support us and significantly contributed to our efforts at tackling and containing insecurity in Nigeria.
After his message to the people of this community, others gave credence to the very essence of the army in partnership with civil society on these auspices.
A facility that symbolizes progress, care and power of community unity, reconstructed, remodified, renovated, furnished and equipped by our esteemed son, Major General A.A. Adeyinka, as part of his selected project under the Chief of Army Staff Special Intervention Civil Military Cooperative CIMIC project, and in honor of his father, our beloved and highly respected community leader, Engineer Adisa Adeyinka. Therefore, this day is not just about the commissioning of a healthcare facility. It's about honoring a remarkable individual whose life and legacy will continue to inspire and impact the lives of countless others within our community. First and foremost, I would like to express my deepest gratitude to Major General A.A. Adeyinka, a proud son of the soil, a highly refined soldier who always balances the discipline of a warrior with the grace of nobility.
The way and manner for carrying out of the commissioning of the healthcare center will be clearly laid out to avoid a rowdy experience, as many more look forward to it.
We also have Yemi there supporting another 100, so we have 300 additional people that will be coming on the scheme. I'm certain that, okay, I have another 100, so I have 400 already supporting the scheme. I know several people will want to support this. Please, we will not take too much time before we cross the line and turn it into another program. So, but just know that we have 500 now, 500 persons. So we'll do all the students from GS1 to SS3 for 1 year. that should be covered, and then like it has been whispered to me, the women inside the community will see how we'll do the rest.
He has taken health and he has tied it to education. Because when we were discussing who are those that are going to enjoy his free health insurance, we were suggesting let's take people in the village. He said no, I want to use it to encourage people to go to school. I want to encourage those students that are in school and also take care of their health, which is what he did. And he has asked us to enroll 256 children. Those are all the people in GSS 1 to GSS 3. And by so doing, they are sure of free medical and surgical intervention for 1 year. But I have a message for you, Augusta. When I got there, the principal said there was a small mistake, that the children are actually 287. I said, don't worry, let's enroll. We will sort the issue of money later on. So the 256 has moved to 287. I promised the principal I was going to deliver that message, and I've delivered it. But a very laudable project, and he has paid millions of naira. It is not promises. He has paid all the premium for these people to the Ogun State Health Insurance Agency.
Long awaited indeed, it soon became time for the commissioning proper, which marks the high point of the day.
I must therefore at this juncture specially express my deep and sincere appreciation to our Chief of Army Staff for his magnanimity and unflinching support in the execution of this project. I say thank you, sir. This project covered the remodeling, renovation, furnishing and equipping of Olugbo Primary Healthcare Center, as well as its staff quarters. It also involved the construction of a new solar-powered borehole and a water recirculation system to the buildings, as well as the installation of a solar inverter system to power the healthcare center. All these were done to ensure that this facility is restored to a state that it will be able to effectively provide primary health care to over 62 communities and more than 8,000 persons that will depend on it. It is pertinent to state that the choice of this project was informed by need and the anticipated impact. I want to sincerely thank my father, Engineer Samuel Adisa Adeyinka, ably supported by Honorable Shina Oluga, for their painstaking efforts in identifying this facility. I also wish to express my thanks to the chairman of the Odeda local government, my able chair, like I refer to her, for her magnanimity. And this is new, my father doesn't know this, that the healthcare center, the local government has decided to name the healthcare center after you. I thank you, madam. In its new state, this facility will free the impacted communities, especially the pregnant women and children, from the rigors of traveling over 40 kilometers to the nearest government medical care centers. I therefore wish to urge the people of Olugbo community to take good advantage of this opportunity and also ensure that it is adequately protected and maintained. In the same light, I wish to appeal to the State Minister of Health as the owners, the key partners in this project, to kindly reinforce the number of staff at the center with a doctor, 2 midwives, 2 pharmacy technicians, 2 laboratory technicians, and 1 health attendant in order to optimize the delivery of healthcare to our community. Yes, sir, we have the dispensary, sir. Sir, what?
Oluyede hereby commission this remodeled primary health care center for the benefit of provision of effective healthcare management for the people of Olugbo and environs. It's gone. Okay. No problem.
Run a drug control scheme. So that's why we have to manage method. So I tell you about that one. Thank you, sir. Thank you, sir.
Adeyinka Primary Healthcare Center, Olugbo, a Nigerian Army Civil Military Cooperation Project, executed by Major General A.A. Adeyinka, GSS, GMH, GSS, Commander Nigerian Corps of Supply and Transport, commissioned by Lieutenant General O.O. Oluyede, the Chief of Army Staff, on this day, 27 November 2020.
The leader of Olugbo community had a few words of appreciation as he did ask for more.
Gbogbo bí tó ní kálukú náà bá ti jáde wá ilé ayọ̀ lẹ máa bá gbogbo bẹ́ẹ̀ ṣe wá síbí láyọ̀ àtàlàáfíà báyìí náà lẹ máa padà síbẹ̀ láyọ̀ àtàlàáfíà Ọlọ́run á dúró tì yín. Mo wá rọ̀ yín ẹ jọ̀ọ́ gbogbo àwọn tó wà níjọba ẹ̀rí bọ́nà ìṣòro ọ̀nà yìí ti wà báyìí nísìnyí ó ń lọ 20 years sef because tàbá ń bọ̀ ń bí èèyàn máa ń ronú lẹ́ẹ̀mẹ́ta ni you think twice 3 times sef before you can come to this axis because of the bad road. So whoever God put it in mind or chooses to be, they want to do it, please don't hesitate. We've shouted, we've talked, but the government at times is like we don't even have one because they will hear you, you will write to them, they will never reply you. So I want to please, for God's sake, the Honorable Elemide has said it. It is for every one of us. They all came from this axis. They are all my subjects. But they've tried their own best possible too. And I still want to go and see him to discuss with him in order to facilitate the rehabilitation of this road or even total reconstruction of the road is needed, not rehabilitation. Because you see them, they take some money. They will just do some wuru job and tell you that they will renovate the road. Getting here, another 1 year is gone.
The senator for Ogun Central is an indigenous of Odeda. In fact, the first senator in Ogun State, Chief Shubeng, was an indigenous of Odeda. And the current senator is an indigenous of Odeda. But alas, not many of us have come back to behold at that local government that bred us, where we drank the water, where we ate their corn, where we played together on our pathways. So, Engineer Adeyinka, I really once again appreciate what you have done. And I want to appreciate the military hierarchy from the Chief of Army Staff down the ladder. Because if you had said you wanted to do it and the military is obeyed the last order, if there is no cooperation, this thing may not be here. So all the military, you have become my constituency as from today. Our people are here. You cannot know the enormity of this gesture. I once spoke to the Commissioner for Health about this place. So one of the days I told her, he said, somebody is already working on it. I want to know that person. Because look at the road from here to Odeda. The road was constructed in 2001. That was when Chief Olusegun Oshoba constructed this road. He was my governor then. We went to him, Oga, give us this road. And he said, you did not vote for me. I said, Oga, you promised us. And he said, I will do it. I will see if you will vote for me the second time. But his second time never came to be. But since then, you can see what you went through. And I've been on the neck of this government that please, our people are not animals. Our people are not non-entities. You have done this. I really appreciate you. Ẹ̀yin bàbá, ẹ̀yin lẹ fowó rán wa níwèé màá sọ Yorùbá mo kí gbogbo wa pátápátá ní gbogbo ọpọ́n alárọ̀kọ pátápátá ẹ jọ̀ọ́ tí a bá ti ń lo hospital yìí ẹ máa gbàdúrà fún ẹni tó ṣokùnfà ẹ máa gbàdúrà fún alága council tó wà níbẹ̀ nítorí pé orí ẹ̀ ló sọre ọ̀rẹ́ mi ló jókòó yẹn Sẹ́ríkí Ẹ̀gbá ajọmúmi lé olú ni ajọmúmi Olugbo ni òun náà ní Sẹ́ríkí Ẹ̀gbá kábíyèsí ẹ máa gbàdúrà fún gbogbo àwọn tí Ọlọ́run lò láti ṣe iṣẹ́ yìí tí wọ́n mú wá ká wá máa lò ó bó ṣe yẹ kí a lò ó. I want to implore the representative of the Honorable Commissioner for Health, who coincidentally is my wife. P.S. Tell your Oga that we need a doctor here.
As the day winds down, it is clear that the Army's efforts, through the initiative of the Chief of Army Staff, is noble to crystallize civil-military relations in the best possible way. Gimba Umar, Control TV, News Mobile.